Well, hello everyone. My name is Teresa Johnson, and I'm the Director of Research and Planning for New Brunswick Public Library Service, and I'd like to welcome you all today to the CULC Think Tank webinar on Collections Toolkit. You can find this toolkit on the CULC website, and this webinar is being recorded and made available on the CULC Think Tank webpage. The chat room will be open for the full duration of the webinar, and a transcript of the chat will be made available as well as part of the archive version. As part of this presentation, we're planning to take about 30 minutes or thereabouts to present information from the toolkit and 30 minutes to have time for your questions. To start, I'd like to introduce our presenters today. Mary Cavanagh from the University of Ottawa, Michael Ciccone from London Public Library, Sharon from Edmonton Public Library, Edmund from Whitehots, Chantale Saulnier from the Brunswick Public Library Service, and our special guest, Lisa McDonough from Vaughan Public Libraries. So I'd like to take a moment to provide you with some context on the purpose of the toolkit. This toolkit does not constitute legal advice, but and also it's not a document where you'll find all the answers. As we know, the science and the practice of COVID-19 response is changing, and the right answer to our questions may look different from one jurisdiction to another and from one library space to another. So with this context in mind, the purpose of the toolkit has been to be practical, timely, and accessible, to be relevant to as many public libraries as possible, to also help us ask the right questions, and to share innovative responses and common solutions used by libraries and related sectors. I'd also like to highlight some of the guiding principles that have informed the development of the toolkit. First and foremost is health and safety, and all the measures we take in providing access to our collections. We also need to be mindful of the barriers in accessing our collections, and that there will be more vulnerable people due to health and economic reasons. And for this reason, inclusion and accessibility will be key factors in our service planning. We will need to be mindful of barriers in accessing our collections because there will be more focus on vulnerable people due to health and economic reasons. And for this reason, again, inclusion and accessibility are important. We'll need to recognize that there is an accelerated use of digital collections and the role of technology. And this means considerations for those who do not have access. We also need to consider providing access to information and knowledge in various formats, multiple formats, and this will be key to supporting community connection and social and economic inclusion. And of course, as public institutions, we're committed to working in diverse, remote, rural, and urban communities across the country, and committed to reconciliation, environmental sustainability, innovation, partnership, and responsible financial stewardship. So with all this in mind, the toolkit is broken up into 4 parts: key considerations, best and leading practices or emerging practices in our field, as well as stories from the field in terms of library examples, and some key resources. So with that, I'm going to turn it over to Mary.
So thank you, Teresa. I'm just going to highlight the key considerations that our committee prioritized in terms of this aspect of opening for service. 3 areas: general materials handling, and in that area we were looking at best practices for how to handle materials. The Institute for Museum and Library Services in the States is in a partnership project with OCLC and the Battelle Institute, looking at how to ensure safe handling of library materials. As research emerges, guidelines for handling materials may change, and we know that. So there are links at the end of the report in each of these areas for you to follow up, and please, I'm sure you're aware, they will change. The information may change. We were also looking at customer access to collections with emphasis on circulation. what services could be offered to limit physical contact and support access for all, particularly vulnerable groups, what membership and circulation policies should be reviewed to encourage library use and equitable access, and what are the considerations for planning a curbside service. And you'll hear more about that from the representative from Vaughan. Finally, we were looking at collection development in the back room, how to balance collections with new restraints and demands. Part of that will be budgetary, of course, and how should acquisitions, cataloging, and processing workflows be adjusted. So those were the three considerations that we dove into, and I'll now pass it on to Chantale.
So first, we're going to be looking at best and leading practices within general materials handling. First, we're going to be looking at protective measures. This image shows the hierarchy of controls and the framework for reducing the transmission of hazards, where physical distancing is the most effective and personal protective equipment is less effective. These are like the measures already put in place in the retail sector and grocery stores, and the same principles will apply in a library setting and when dealing with library collections. For the workplace, a hazard is a situation, condition, or thing that may be dangerous to the health or safety of workers. Under this definition, COVID-19 is a hazard, and provincial occupational health and safety codes will typically state that employers must eliminate hazards, or if that is not reasonable, practicable, control hazards. In the image on this slide, the most effective controls are at the top of the pyramid, with the first being physical distancing. This is the most effective protective measure we can put in place and consider when dealing with any service. All library collections should be handled by using physical distancing measures, such as ensuring library staff have the space to keep their distance. This will need to be assessed at each site. Some locations may not have the option to open during earlier phases if they are very small. Another option is to have staff work remotely, so that those staff who need to be on site to deal with materials are able to adequately space out, and we should be using hand hygiene measures between tasks. Another option is to look at engineering controls, which is how to control the hazard at the source. We can do this by regularly cleaning and disinfecting of surface using an improved disinfectant for the COVID-19 virus. Next, there's administrative controls, which is the control of the hazard between the hazard and the worker. This can be done by regularly cleaning and disinfecting surfaces that are used for handling collections, and practicing good hygiene, such as not touching your eyes, nose, and mouth. Lastly is personal protective equipment, which is the least effective, and is best to consider for use only when physical distancing is not possible. This can be done by wearing a non-medical mask, and face coverings can be an additional measure taken to protect others. Gloves can pose a higher risk if they are not used properly, and for this reason, they need to be used very cautiously. The safest method when handling library materials is to use hand washing between tasks. When materials handling is happening between staff and customers, physical barriers such as glass or plastic windows at service counters are an option to help reduce exposure to COVID-19 virus when physical distancing is not possible. And as always, we should be washing our hands, not touching our face, and regularly cleaning and disinfecting surfaces. Next, we will look at mitigation strategies. When dealing with library collections of any kind, time in quarantine is the best method for disinfecting. The most commonly used quarantine period for library materials, such as books or DVDs, to reduce the risk of COVID-19 virus spread is 72 hours. For this period, the material should be placed in boxes, containers, or set aside on a designated table, date marked, and where possible, stored in a separate area. Collections shipped between libraries or from vendors should be quarantined if it is not confirmed how long they have been in transit. And a significant concern for libraries is about how to deal with the volume of returned materials when libraries open. This is going to be a challenge, there is no doubt about that, and we should look to ways to control the volume, such as making room on your shelves for the material for reshelving after quarantine period, which can be done by weeding out your collection. We can also attempt to prevent a massive return of materials by encouraging the public to use staggered return approaches. Another way is to look at automated processes. Libraries should consult their integrated library system vendor and user groups to learn about automated options to manage the volume of materials, as well as the quarantine period you need to build in after check-in, for example, rolling returns and checkout dates. Another way is to prioritize. Review the types of materials that can be browsed or borrowed by users, and consider prioritizing items that are available to the public based on balancing community needs and the library's space to quarantine. Think about how you will manage items that a customer has touched in branch if you're allowing browsing. For example, newspapers and magazines are used a lot in-house and shared frequently. Should these be discouraged and disallowed? Toys, games, tools, Wi-Fi hotspots, and instruments may not be possible to share, or if used, will need to be quarantined. Consider if they are a priority service. This will also help to minimize handling, which is our last strategy. Seek solutions that see staff and customers touching items as infrequently as possible, such as closed stacks could be considered in the earlier days, or floating the collection to reduce material handling. Lastly, we will be looking at the best practices for cleaning and disinfecting. As we mentioned earlier, time is the best disinfectant for all types of material. This is particularly important with books, where the virus could live not only on the exterior, but also on the interior pages. The other concern is potential damage to library materials. One frequently asked question is about UV lights as a disinfectant. This is not considered a best practice because ultraviolet light also poses a potential risk to a collection of materials because of its high intensity. For exposure to be effective, it must be complete exposure, something that is almost impossible to achieve with bound books, and is certainly not as effective as quarantine. There are some library practices of disinfecting materials that are made of plastic or metal. This would depend on your library resources, and using an alcohol-based cleaner would be an option. Also, hard surfaces used to handle collections should be regularly cleaned using an approved disinfectant for COVID-19 virus. Lastly, libraries should inform the public of their safe handling protocols to deter users from using at-home solutions that could damage collections. Next, I'll turn it over to Sharon.
Hi there, can everybody hear me? Okay, I see somebody said hello. Hello, iPad Rita. Sorry for the mix up there. So, we're looking at customer, when we're looking at planning to reopen, we're looking at likely for very many locations considering a phased approach. So this will often look like offering a hold pickup service and or limiting browsing of the shelves with physical distancing in place. Of course, this is something that you're going to need to take a look at your locations because it may be very different on the kinds of solutions that you can provide. Budget permitting, you could be exploring contact options such as self-checkout kiosk or apps, booking vending machines, hold lockers, and other sorts of solutions that are contactless. But the other thing you really want to keep in mind is vulnerable sectors. So making sure that you're considering offering designated visiting hours for on-risk populations, expanding outreach services to people who are not comfortable with visiting the library or unable to visit due to other barriers, or expanded outreach services, which could include things like deposit collections or books by mail. Providing options for users to request materials such as online, telephone, email, chat are all really important. Other things to consider would be support to people with disabilities. So examples can include reaching out to users to inform them of their options to access collections. Many libraries are adapting curbside services as a model to provide access to collections during library closures. So curbside service is also being used as an additional model when libraries are open as well to help serve more customers, as we're looking to often limit the amount of people that we can have in our spaces. As library practices are just emerging, we're focused on key questions for planning a curbside service, recognizing that each library service model will be different based on resources, facilities, and location. Thinking about health and safety, what are the health and safety protocols that need to be followed in your community to mitigate the spread of COVID-19? How will the library put in place physical distancing, physical barriers, cleaning and disinfecting protocols of frequently touched surfaces, hand hygiene measures, protective personal equipment requirements, etc.? Does the library have adequate space to separately quarantine materials and to separately assemble materials for pickup? So it's going to be different per branch, and you'll need to assess at your location. Thinking about resourcing, does the library have the staff available to manage curbside pickup services along with other services that may be in operation? Will the service be offered on a short-term basis? For example, during the pandemic period, when libraries when you're required to close, or will it be long-term? So an extension of library services to vulnerable sectors after you phase back in your services. Collections, what will be included in the scope of your service? Will it include only books, CDs, and DVDs? With different circulation procedures, they may be required. So for example, the number of checkouts, holds, loan periods, and fee forgiveness. Will the return of items be accepted, and when, and how will you stagger that? Thinking about your requests, what options will users have to make requests? Will they be just using the online catalog? Will you create a different online form to facilitate the requests? Maybe it'll be telephone or email, maybe it'll be text. What solutions will be needed to track and manage your requests, such as phone and email logs? Assembling your items, what supplies are you going to need to assemble items for pickup? Think about the measures you put in place to organize and store these items that you're preparing for pickup. And what measures will you need to be putting in place to ensure your customer or your patron privacy while you're making sure that they're assembling and queuing for customers to pick up? Your pickups, other things to consider, where can the pickup occur that can be done safely while respecting physical distancing? So, I mean, thinking about, would that be at the library door? Maybe it'll be on a lobby, a sidewalk, in the parking lot. Can you have parking reserved for the service? Signage is going to be really important, thinking through all of those considerations. And how will the library manage and schedule pickup times? Will users be required to show IDs, give their name, or will they be allowed to pick up items on their own if you're doing contactless delivery? Another consideration is if you'll be allowing pickup material for customers or for patrons who may not have transportation or are housebound. How will you be providing services there? So consider free library memberships or extending the term of your library memberships. So when you're thinking about rolling out those services, how are you ensuring that the most people in your community have the option to get those library memberships? Something that a lot of libraries are thinking about going for the short term or even for longer are fine embargoes. Review the acceptable collection loss rate and the threshold for making collection agencies referrals for accumulated overdue fines. Expand membership profile options. So for example, can you offer limited circulation cards to permit people without a proof of address to borrow materials? Can you offer educator profiles with extended loan periods and checkout limits to support homeschooling? Can you extend memberships to those who work within the library service area but live in surrounding municipalities? Consider ways of verifying online requests for a library membership without the user having to visit the library. One example you can consider is Overdrive's instant digital card that is verified by postal code and uses a contracted service provider to validate proof of ID and address. And then of course, take a look at your circulation policies and procedures. So lending terms such as due dates, hold limits, checkout limits, renewal limits, you're looking to balance those needs with all of your library resources. Okay, so we're moving on quite quickly to collection development, and so I'm going to pass that over to Edmund to speak to that.
Thank you, Sharon. We've touched on two of the three key considerations: general material handling and customer access to collections. In this section, we focus on collection development. To help in balancing new demands and restraints, we recommend a review of the acquisition budget, making adjustments to reflect changing demands for formats, genres, subject areas, and collection areas such as newspapers, magazines, and travel. Review with your vendor any automatic release plans or standing orders to ensure budget allocations are in line with new demands. In regards to acquisitions, cataloging, and processing, resume operations as soon as possible to prevent collection backlogs and a stable flow of new materials for circulation. Review staff workflows to help reduce the handling of collections where feasible to reduce touch points. Create clearly identified spaces for incoming and outgoing materials. Consult vendors to consider staggered delivery schedules to help manage limited storage space. And consider suspending book donations if there is a shortage of storage space. Key message throughout: physical distancing of staff, frequent hand washing between tasks, and cleaning and disinfecting of high-touch service areas. And with that, I pass it back to Michael.
Hello, and quite honestly, my job is relatively easy. We're going to do a few stories from the field. Luckily, we've had a couple of libraries that have already started this. The first is Vaughan Public Library, and I'm going to turn it over to Lisa McDonough, who is the Deputy CEO of Vaughan Public Library. Oh, sorry, Vaughan Public Libraries. I said library singular. To just talk about what they launched, and I believe they launched last Monday, but Lisa, you can go ahead and give all the details.
Okay, thanks, Michael, and good afternoon, everyone. So like Michael said, we launched Curbside at VPL. We had a soft launch on Thursday, May 14th, when our website went live, but the media and social media for that came really on the Friday, on May 15th. So we've been doing it, today would be our first 2 weeks into the curbside delivery service. So basically we developed the service after doing extensive research into best practices, which that might be a bit of a stretch because there's limited best practices on it, but we did look into what was happening in the United States and for what we could find in Canada. And we had a team that spent about a month preparing all the protocols for the service, including, the marketing and the website form that went along with the service. And along with that, I would say that the largest component was probably the development of the health and safety protocols that went along with the service. There were logistical requirements for sure, but I'd say our main approach was to look at the health and safety of staff and also the customer service aspect we wanted to do. So we approached the curbside service with those two things in mind. As part of our planning process, we did assess the risk, feeling that we were going to be one of the first people out the gate at this. We wanted to be sure we were being very careful and ensuring staff safety. So we worked closely with our health and safety partners at the City of Vaughan to review our plan to make sure that they were comfortable with it. And once we got the sign off, we went ahead. Part of the procedures do include the personal protective equipment, which includes on our end is including providing staff with masks and gloves and hand sanitizer and disinfecting wipes. But generally speaking, the whole procedures are designed to minimize contact with customers. So we are not letting customers in the branch. It's, like you said, it's curbside pickup. So we leave the materials outside for customers while respecting the physical distancing requirements. So it's gone extremely well. We've had, on the very first day on our soft launch, we had 46 requests over the course of that first evening. I think the website went live maybe around the middle of the afternoon on the Thursday, and by the end of that day, we had 46 requests, and the number's just gone up from there. We now have close to 1,200 requests that we are working through. Our staff have completed almost 600 of those, so we're almost at the 50% mark, but we keep getting more requests every day. So it just keeps going up and up and up, but it's all very positive and we're quite excited by it. Our website has also been visited quite a bit. We've had 6,000 unique visits or views of our website, especially the curbside page since we launched it. And on average, people are spending about 4 minutes on our site, or on that curbside page. So we know they're taking the time to review the form and to submit their requests. The service is currently being offered at our 3 resource libraries. And we initially started off with 1 weekday slot, time slot for each resource library, and then a rotating weekend. But based on demands, we've been increasing that as we've needed to meet the demand. The service includes a personalized reader's advisory service, or we've expanded it now to include just straight holds pickup if that's what customers are interested in. But we're only loaning materials from our 3 resource libraries that are available at the branch. We aren't offering the courier service between all of our locations. We have 10 locations right now. And just in general, the appointments are in 15-minute intervals, but we've also had one branch that had to take a more flexible approach and just do hour time slots for a group of people just based on the demand. So there has been some flexibility and adjustments as we go. But most of the content that Sharon covered in her slides, all the considerations was many of the things that we looked into as well in terms of safe material handling and such. We are looking at possibly expanding curbside to our other branches because we know we're not serving the entire community by just offering it in our 3 locations. However, I think we need to settle with what we're doing first before we start expanding it to all 10 branches. So we hope to get there eventually. And in general, our staffing approach has been all about safety, reassurance, team effort, and flexibility. Due to the volume of requests, we've been encouraging flexibility just so that each branch can put their own stamp on it to make sure it works best for them. And another thing we did is all of our executive team came out on the first day of service to support our staff in the launch, to let them know that if they were going to be asked to go outside and do the curbside service, that we would be out there with them as well. So we wanted to demonstrate solidarity with our staff. And I think I'll leave it at that. And then I'm assuming there's probably going to be some questions that we'll be able to take in a little bit. Okay, thanks, Michael.
Actually, Lisa, one question came while you were speaking, and maybe you can just speak to that quickly before we jump over. The question is, how long does it take for your staff to prepare the materials to be ready for pickup?
It varies widely depending on what's being asked for. So if it's a straight hold pickups, for example, holds have been on the shelf since we closed in the middle of March. So if somebody says they want to just pick up their holds, that's just a quick grab off the shelf and packaging. But because we're offering the personalized readers advisory service, people are allowed to submit wide open requests saying, could you help me find some books on, this genre, or could you help pick some picture books for my child. So those requests do take longer. Some of them are quite involved and some of them are quite short. So again, there's no straight answer to that. It varies wildly. Do you want me to keep answering the questions on the screen? I see one just popped up there.
I think we have probably time, if that's okay, Michael, before we jump to Coquitlam.
Yeah, absolutely. Go ahead.
Okay, so I think the question was, do we limit the number of books? Unofficially, no, or the number of items. Unofficially, no. We said to staff to use their discretion. I think we did have one customer who had requested 90 items, and through a conversation with our staff, it was negotiated to about 60 items, but that turned into a very positive reader's advisory and customer service interaction. So he certainly wasn't happy. He was thrilled that, he certainly was very happy. He was thrilled that we were able to give him the 60 books or 60 items, but we've told our staff to use our discretion based on how many materials are in the branch. So if we start to get to a point where it seems excessive, or we're cleaning out a certain subject area, or we're cleaning out a certain format, then we might say, oh, we can only give you 10 of these as opposed to 20 of those. But again, it's a case-by-case basis.
Two more. One is how our staff checking out materials for customers.
Sorry, how our staff checking
No,
out?
I'm sorry, our staff checking out materials for customers. Doing the actual checkouts, I think.
Yeah, we're doing the actual checkout. So we check them out in advance and then put them in the bag and then give it to them in the bag. Is that the question?
Yep, I think so.
Yeah. Okay. All right.
And the other is, do you anticipate expanding to all 10 branches, or how long will that, is that in the plans, I suppose, is the question.
Yeah, we don't know for sure. We know we want to, even if we can do a limited, a half day or 1 day, rotating through our smaller community branches, but we don't have a fixed timeline. We still have, we're getting anywhere from 75 to 100 requests per day for the 3 community branches. So we are struggling a little bit trying to keep up with the demand. So it's just going to, again, if it calms down, if the volume of requests for those resource libraries starts to peter off soon, then we'll expand to the community branches sooner. It just depends again on that volume and what we can handle in terms of our own staff capacity.
Okay, thank you, Lisa. We'll let you off the hook for now while there are no questions coming through.
Right. Thanks, Mike.
And I'm gonna I'm going to be presenting on behalf of Coquitlam in BC. And it will be relatively quick, but fair warning, if you have questions about their service, I may not be able to answer those questions, but I'm sure the information will be available, and there's information on their website as well if you wanted to get a hold of Coquitlam. Coquitlam, they were kind enough to share, and thank you to Jay Peters, Todd, and the Coquitlam staff for all the information they provided. They provided some information about their service and photos from their curbside service. And what I gleaned from reading about the service is that the approach that most libraries are adopting and what the think tank has suggested has been put into practice by Coquitlam for a good month now and has proven effective. So that's really, really good news to read about that. Coquitlam also, a lot of libraries that we've talked to have been talking about doing these grab bags, like creating just packets of materials for people so they don't have to do the thinking. We do the thinking for them, maybe incorporated into some sort of reader's advisory service that you already have. Right now they have 60 grab bag titles for customers to put on hold. Some of the examples of the topics are adult cozy mystery, teen graphic novels, food lovers, kids funny books, and this started on May 4th, and as of May 28th, they have 252 holds for the grab bags. So they are also creating grab bags on request, which I think is really great. But the thing I thought was the best was they gave me some information about how staff are responding to the service. And as you can see here, just some of the quotes, the curbside is going very well. It has been great to know how appreciative the service is in the community and how much our customers miss us. Staff have been really loving being able to work and provide, sorry, that's my dog, provide service to the community. All the positive feedback really helps to boost everyone's spirits. Next time I think about buying a beagle, I should probably think about this very moment. Our staff are the experts and have great feedback and ideas for how to improve things. We were very impressed by how adaptable and innovative they have been during this very new process. So I think that to me was really, really great to read. We plan on at London launching in about a week and a half, and I think if we have staff on this webinar seeing this, I think maybe give them a little bit of relief. Anyway, I think I'm going to turn it back now to Teresa. I don't know if there are any questions there, Sharon.
Michael, yeah. Do you happen to know how many items are per bag?
I think up to 5 is what my understanding is.
Okay. And then for, I don't know if this will be for Lisa to answer or if anybody has an answer to this, but I have a question about interlibrary loans. So if there's anybody who's started interlibrary loan service yet.
I can only answer for us. We haven't really even, it's not high priority right now. I think there's just so much, there's so many differences between library systems, municipalities, and what they're allowed to do and what they're not allowed to do that we haven't really even given it a thought yet. I can only speak for London.
Yeah, and I would say the same in Edmonton as well, that in Alberta, the interlibrary loan service we haven't even begun back our phased recovery for the most part. And so that's still kind of on the back burner.
There's some good stuff happening in chat that aren't necessarily questions, but information being shared. So if anybody has a chance to read some of that, we just got one from Rhina from GBPL. Not necessarily questions, just information that I don't need to read every one of them. And I believe this information will be available after the webinar.
Also, we've got some questions around bags and if people are using plastic or paper bags. I don't know if Lisa wants to speak to that.
Sure, that's an easy question. Don't give me a hard one, just an easy one. What we're doing is we have cloth bags that we are handing out for free. We usually sell them, but we also recently rebranded, so these bags are going to go by the wayside eventually. So we decided that we would just give them out as a small perk for everyone who uses curbside service. So there's a new bag with every checkout.
And are you allowing patrons to bring their own bags?
You know what? I haven't actually encountered that request. So I would say unofficially, no, it hasn't come up, but we're already pre-packaging things in the purple bags that you saw on the slide. So they're ready to go and handed to the customer that way. If somebody wanted to switch their materials when they arrived with their own bag. I'm sure staff would accommodate that, but it hasn't been an issue.
In Edmonton, we're working out procedures and we're looking at single-use plastic bags. We have, looking at keeping the cost down as much as possible because we're thinking this is something that could go on for quite some time. There's a conversation in the chat going on about interlibrary loans. It looks like there's different things happening across the country, really. So I think I can leave that conversation in the chat bar because I think there's been a lot of responses there.
Okay, maybe we can turn this over to Teresa just to kind of conclude things, and then we'll open it up to more questions. Is that the best approach there, Teresa?
Sounds good to me. Yeah, so we wanted to highlight also some key resources that we thought would be useful as we try to keep up to date with what's happening in terms of response to COVID-19, and also what are the emerging practices of libraries. So a few that we want to highlight are, of course, library associations and councils that have really great information on their websites on what are the current library guidelines and protocols that are being followed from within North America and beyond. And also social media is a great resource to get practical tips and answers on how to answer your specific planning questions, for instance, like about curbside. And many of you are probably familiar with librarianship.ca. It provides a great archive of libraries in the news and providing pathways for more information. So with that, I just want to reiterate that the toolkit is available on the website with more references that we provided in there of how we came to our different recommendations in the toolkit. And we'd like to open it up for more questions that we can answer. And I'll turn it back to Sharon.
All right, I'm just monitoring the chat. So if anybody has a question, please feel free to drop it in there. Oh, very good. That's going to come quickly. So we've got some questions about board books. Are people treating board books differently than other children's books, given that they may be put in children's mouths? That's something we actually haven't considered yet at Edmonton Public Library because we're just starting our curbside. So I wonder if Lisa, if you're doing your service, if you have anything to say on that.
No, we're not treating them any differently. When items are, everything that's going out right now has been in our branches for 2 months. So we know it's safe and safe to circulate, no problem in terms of that. When items are returned, they're going to be isolated for, the recommended period of time. So that should address any issues with the board books. I think you're thinking, yeah, because kids put them in their mouth. Right?
Exactly. Yeah. I think the quarantine period is the important piece there. Anything that's coming back, whether or not it's a board book or any type of material, really should be thinking of a 72-hour quarantine. Lisa, do you have technical services staff back in your library now that you're offering curbside?
Yes, we do. We do have a blend of information staff and circulation staff assisting with the curbside service. So the information staff are doing the customer service direct, through the email form, navigating the requests, finding items, and then our circulation staff are helping to pull holds and call customers about pickups. And then we also do have some technical support staff working in our information innovative technologies department, doing some processing of materials that are new to the library still, like magazines and things like that.
Thanks. This next question I'm going to ask Edmund to speak to. I've got a question here about how many libraries are accepting shipments from vendors again. Are you able to speak to that, Edmund?
Yeah, sure. So over the last 2 or 3 weeks, more and more small libraries have started to accept shipments. And just in the last few days, some CULC libraries have started to accept shipments. And because of the nature of the virus, they, I think, are going to be last in the line. But yes, it has dramatically changed in the last 2 weeks.
Thank you. I actually have quite a bit of conversation here in the chat bar, for those of you who are monitoring it, about wondering about homebound services. And there are some libraries who have indicated that they are doing some homebound. Is it possible for someone who is doing that service to speak to it? I don't know if we're able to unmute them. Is that a possibility, Jennifer or Teresa?
That's a question for Jennifer. Is there someone in the chat that wants to speak about home delivery service?
I've got people asking people in the chat to speak to it. So I don't know if, while we're working that out, Jennifer, I think that we can maybe speak to the question about magazines, and people are wondering about how best to handle magazines, if we should move those to circulating. I think that's something that's definitely that we've been discussing both on this group and in our library system, where if you've got something in that's going to be heavily managed by different people in your locations, I think that there are many libraries who are considering just no longer offering magazines in-house for the time being, and even potentially canceling their subscriptions for the year. If you are working with magazines and browsing on the floor, you need to consider the quarantine period, likely that you may want to consider a way for anything that's being touched, including magazines and newspapers, to be quarantined after that being touched. So it does get tricky in that you're looking to potentially make sure people are after they put it back down, it then becomes quarantined for a period of time, which takes away the accessibility of something that's very timely and consumable. So it's a tricky one for sure.
I know if you go to librarianship.ca and you look through the posts from the past 2 months, there are several examples of libraries doing home delivery service. Some of it's with using their own vehicles from the library, and the examples I saw are mostly by staff.
I can just share that we do have one situation. It's not a full-fledged home delivery program, but we do have one of our homebound delivery volunteers coming in who agreed to deliver something for someone who's homebound and was unable to take care of curbside. So we just went over some basic health and safety with them and provided them with the basic PPE just to set them off. It's just going to be a door drop, but we're trying to address that on a case-by-case basis.
And just to put a plug in for some of the other toolkits, there is a toolkit on programming and information services, and there are some good examples in those toolkits of alternative delivery models to reach vulnerable populations.
Yeah, in Edmonton, we are doing right now, as far as homebound, what we've been doing is delivering not circulating material, but donated material for people to just take and keep. And we're delivering that to a number of different residences throughout the city using our EPL vans. But we're just doing that in the next couple of weeks, so no experience as of yet.
Lisa, here's a question from me. Are you alerting patrons to put their materials in quarantine when they take them home?
No, what we've done is we have a bookmarked flyer we put in each bag that goes out that talks about how the items are safe to use because they have been in the branch for 2 months and haven't been touched by anybody. So we've reassured them that way that the items are safe to use, that the ones they're getting. But we've also included in that note that in a positive messaging way that encourages them not to use any disinfectant on the material, that if they wanted to self-isolate, they could, but that they are good to go.
And not to ingest it.
Yeah.
And not to put it in the microwave. Don't try to do that on your own. There's just a few comments in the chat around how people are dealing with boxes once they've arrived. I think that we talked about how we want to quarantine the material within the box, but then I think there's some questions around the box itself and how best to handle it. From our perspective, I think that we're looking at when material resumes that we'll be doing as limited amount of touches as possible with any of our material, whether that is putting it aside or not touching it if possible, but if you need to, not at least if you're touching the boxes themselves, it's the good hand hygiene, and that's the most important part there. I wonder if, Edmund, if there's anything that you're recommending as a vendor when it comes to the boxes and the deliveries?
You're on mute, Edmund.
We've implemented a new thing, just a small thing that may help, that we have a COVID-19 label on each carton that goes out, which is dated. So when it leaves, when it arrives at our library's door, they at least know when we last touched it. That doesn't resolve the issue of the carton itself, but I'm sure other vendors will do something similar to what we're doing.
So thank you. So another question here is about planning stages for allowing limited in-library browsing. The comment is that it's easier to promote face out likely than having people touch them. I think I wonder if that's something, Teresa, that you can speak to. I think that you have customers in your branches over in your neck of the woods.
Yes, in New Brunswick Public Libraries, we've just started opening our branches this week with more next week. And our approach is doing a grab and go or holds pickup service, but patrons can spend a limited amount of time. We're recommending 10 to 15 minutes to go in and browse the shelves, pick out their items for circulation. So with that in place, we are recommending if people change their mind and don't want to borrow the book, that they put them in quarantine areas that we've designated, and they're quarantined. That's the approach we're taking right now.
Yeah, I think that a lot of the research that I've done is showing that to be like a leading practice, where there is some way that whatever is touched is put into some kind of a bin for quarantine. So it gets to the point where I think that there's some libraries are allowing people to take baskets with them throughout the space, and then anything that they touch, they put in the basket themselves. And other libraries are saying, whatever you touch, put it on this table or within this bin, or don't reshelve it, so that we can make sure that we have the opportunity to quarantine it.
And it's a practice I've seen referenced with bookstores that are reopening as well.
I think that takes care of almost all of the questions. There's been a lot of commenting if people have had the chance to read in the chat, but I think I've gotten most. Oh, Teresa, question for you. Are you allowing patrons to flip through CDs or DVD bins, or is there only shelving that's face out?
That's a good question. That hasn't come up specifically. So I would understand that, yes, that's being permitted to some extent. But again, it's limited duration visit, 10 to 15 minutes. We're expecting people to come in and out. And if people are touching things they don't want to borrow, then they put them in a quarantine bin. So, yeah.
So Jessica has a question about gloves. So at their library, they're using gloves to hand out parcels, but she's wondering if staff are wearing gloves when they're picking them out at other libraries. I can tell you that maybe I'll go first, and then maybe Lisa, this might be a good one for you to speak to. So I think I saw you had gloves on with your staff. So if you think about the hierarchy of controls that we, on the slide earlier, that the PPE is at the very bottom of the hierarchy, I think that my concern is that if people are wearing gloves, it's really, really important that they have the proper training to ensure the gloves are being worn and used properly, as some research has shown that it can actually increase risk if you're not using them properly. So I think a lot of times from what I've read, staff or customers, people using gloves feel that it's protecting them, but it's really just, it's still on the glove. And if you don't take it out your glove off properly, you just get the virus potentially on your hand, and then you need to make sure that you're not getting it on your hand, you're still washing your hands. So if you are wearing gloves, ensure that if you're using gloves, ensure that there's a really good training. But if you are not, then the hand washing is the other mechanism in place. Lisa, did you want to speak to the gloves in your location?
Sure. Yeah, we are using gloves. We've set up a baseline where we have asked staff to use gloves when they're retrieving the materials from the shelves and when serving the customers, mostly to provide customers with reassurance that our staff are taking all necessary safety precautions. We know, as well as Sharon was saying, that the hand hygiene is paramount. But we have been providing staff with gloves and asking them to use that. There was a question also on the side here about masks, and we have provided our staff with masks. They're the disposable masks, and we are asking staff to use those, not to bring in masks from home, because we know that the masks that we are providing, they're considered, again, I'm not an expert on this, they're level 2 masks. They're a little bit better, I believe, than a homemade mask. So we've asked our staff to use those if they can't maintain physical distancing. However, the masks are optional. That said, there's been more push in Ontario recently to encourage people to wear masks. So when we first created the protocols and the public health guidelines have changed slightly since we created our protocols at the beginning.
And just before we get to Donna's question about monitoring, just to stay on the gloves, we've got a question from David here about gloves that are returned in book drops. I think that the issues are really the same, whether or not it's dealing with material. If they're returned through the book drops, your line of defense to control the hazard is either to keep the material, to keep it off of your hands, proper use of the gloves, or the washing of your hands, just to make sure that, and then a good hygiene, like not touching your hands to your face. So regardless of if you decide to go with gloves or not, just if you do, it's just really important that staff are trained to use them properly.
Sharon, this is Michael. I was trying to bring up that the slide that we had on our PowerPoint about the inverted, where the
hazard of controls.
Yes, or I think that, and we've been certainly preaching this, that really the washing of the hands, the keeping the hands away from the face, and the distancing are really the best ways to avoid spreading the disease, and that has been preached from day one. The PPE is nice, and as Lisa said, it's good in terms of, I think it helps in terms of perception by the public and the optics. But in the end, those 3 practices are going to be much more effective at mitigating the spread of the virus than anything else that we can do.
Teresa, to go back to what you were talking about earlier about having people in your branches, I have a question here about how you are controlling or tracking that to make sure there's 10 to 15 minutes of a duration for each visit.
We're not policing it, but we are monitoring it, I guess, in terms of limiting the number of people who come in at a time. So as we reopen, we're just in the early stages. We do have screeners at the door. So library staff are there to greet people, to kind of help explain what the expectations are when you enter the library, that things are going to look a little different or quite different. And so we're approaching it that way. So so far people are respecting that we're trying to keep it to 10 to 15 minutes and allow more people in at a time, or and a queue. So it's been working well so far.
Okay, thank you. So I think that's all we have in the questions for right now. If we have anybody else that wants to put something in there, I'm going to just quickly go back to something that Lisa earlier, a valued colleague of mine who we work with on the e-content working group, had recommended that I give talk a little bit about One Read Canada. I think a lot of you are aware of the CULC program. Where it was a digital book club from across the country. And we had our first inaugural program last year, and that we had been planning to do a new program, but then we were a little bit put behind because of COVID. So we are looking at working with a couple of publishers to get rolling on another program to come up this fall. And so we're looking at probably the month of November to roll out our next program. So as far as an announcement, I think that we'll be looking to do that quite quickly here. So just stay tuned. That the importance of us connecting as all, across the country in digital ways, and libraries leading that connection. I think it's a really good opportunity for us to do that, to promote digital content in any way that we can, since I think the new normal here, or the new now, is going to be like this for a little bit of time. And so I think we could be seeing a little bit of trepidation with the use of physical material. And if we can in any way encourage people to be using our services in a way that makes them feel very safe, a digital book club that connects us all as Canadians across the country, and having a great literary program is a great way to do that. So there'll be more news coming from CULC soon around a fall program to do another Canadian-wide digital reading program. So thanks, Lisa. I see Rhina said, Rhina's reaching out to me as well about digital programming options for all people who have that option. Digital programming is something I think that they're speaking to more in the programming group, but absolutely that's something that we need to be looking at as libraries right now for sure. Any other last minute questions? I think we've got about 2 minutes. Question here about if anybody is reducing physical content, but sorry, a pop-up just got in the way of my question. Any content budgets and moving money to digital and what percentage they are moving? Yeah, good question, Michelle. Definitely, we are doing that at Edmonton Public Library. I see that Lisa's saying that they're moving to 25% up to 50 for 2020, something similar. I would say we're monitoring as we go. As we're seeing a huge, like we're seeing in the 100% increases of digital content borrowing happening. And so as we know, we're buying and receiving less physical. We've been shifting money into digital as we go forward and looking at what people are using and then kind of just moving it and shifting it as we see it. So I would say as of right now, we're probably in about the 25% range already moved to digital. And we could go a lot higher than that depending on how long these restrictions are in place. Michael, did you want to speak to that at all as well, or?
Sorry, I'm trying to unmute. We don't have any hard data or numbers, but yes, definitely we are. I mean, I think we've very, very clear that even if we go back and buy books that we wanted to buy before, we're not going to be buying them in the volume that we were originally intended on buying. So there's money there. We are certainly looking at magazines. We're certainly looking at our music CD collection and other areas where we could probably save some money and push it to digital. But of course, we're also looking at the possibility of budget shortfalls as well and taking that into consideration. So there's a lot of thought going into it. But in the end, yes, we are definitely pushing more towards digital to meet the demand that we're seeing. I just wanted to let you know, I did put, Jay Peters gave me permission to put his email address into the chat from Conquitlam. So if anybody has any questions, they could send it to Jay. He was really, really generous with putting some information together for me. And if you have any questions for him, you can contact him directly.
That brings us right to noon. So Teresa, is there anything further that you wanted to say before we wrap up?
Just a huge thank you to everyone who joined us today on the webinar, and a huge thank you to the working group that we've been working together for the past month, doing research and looking at best practices and sharing those practices, and it's been a great experience, and I want to thank you all very much. Just a plug to please look to the CULC website for the other toolkits. They all are full of great information, and stay safe.
And thank you, Teresa, for keeping us all corralled.
Thank you.
Thanks.